General election, and joining us is Michael Tanner. He's a senior fellow at the Cato Institute in Washington, D.C. He's an expert in healthcare, welfare, entitlements, and authored a number of books, including the report Bad Medicine. He's also referred to as one of the architects of the private Social Security accounts movement. Good to see you. And we'll talk about, for another day, the Social Security thing. Let's talk about free market. Now, you're for the free market in the healthcare system, but apparently it hasn't worked for everyone, or we wouldn't be where we are.
Well, we shouldn't pretend that we've actually had a free market in healthcare. The fact is that most people buying healthcare do not actually pay for their own healthcare. About half of all healthcare in this country is paid for by the federal government. About 37% is subsidized through their employee or employer. And we have basically cartels among the insurance companies in the system because people are not able to shop nationwide for their health insurance. They're limited in Wyoming to being able to shop only for the insurers that are licensed in Wyoming. That provides sort of a monopoly for a handful of insurance companies here.
This debate about the Affordable Care Act, is it more about values and not policies? I mean, the Democrats say, you know, benevolence they use, we're brothers keepers, everyone has a basic right to basic health insurance. Republicans, rugged individualism, free market.
Both of those attitudes, I think, are actually wrong. People talk about health care as either a right or a privilege. The fact is, health care is a commodity. There's a finite number of doctors, hospitals, and money. So there's always going to be a debate over how best to utilize those resources. Right now, for example, you're debating whether or not to expand your Medicaid program to take in what could be as much as $50 to $100 million in new costs on Wyoming taxpayers if you go ahead and expand the Medicaid program. So that's simply a matter of you only have so much money in the state government to use. Are you going to use it to expand the Medicaid program, or are you going to use it possibly for many other uses that I think are probably more valuable for something like that?
I got to talk about the individual mandate. I know you're a lawyer. And the Supreme Court said it was constitutional. Actually, it's a Republican idea, and I don't know if people know that. Mitt Romney got it from Newt Gingrich, who got it from the Heritage Foundation, Stuart Butler, who doesn't embrace it anymore since the Democrats embraced it. But it's a Republican idea.
Well, that's right. It was originally based on the idea that there are people who go without health insurance, and in this country, even people who are uninsured, if they get hit by a truck or end up in the emergency room, they're going to be treated, and that cost is passed on to all of us. But that cost can be overestimated. It's about 2.5% of total health care spending in this country. When we have about $3 trillion that we spend on health care overall, that's a surprisingly small amount. And the individual mandate, not only is it imposition on individual liberty, it's not just about being uninsured, it's about whether or not you have the insurance that the government wants you to have. For example, people living in Wyoming, about half of them who are in the private insurance market are not going to have health care policies that meet the government specifications for what must be in their health care plan, and over time they will eventually have to change their current health insurance to bring it into compliance, even if that new health insurance is more expensive, has benefits they don't want, or even benefits they might be morally opposed to.
Michael, we're out of time.